Okay, so I think I'm gonna get started. Does that sound good? So we're gonna talk about detoxification a little bit. We're gonna talk about the liver. We're gonna talk about what your body does in order to process things you don't want, physical things your body doesn't want, and how your body gets rid of it. And then also a little bit how that relates to your immune system, because that has kind of a strong connection. It's not something you automatically think about. And some things to do about it. So my name is Nathan Horek. I am a naturopathic doctor here at Northeast Community Acupuncture and Wellness Center. And I see patients for a variety of usually chronic complaints, but usually involve something in the spectrum of mood, energy, sleep, digestion, stress, and then the conditions that kind of fall in there, some autoimmune diseases, stuff like that. And as a naturopathic doctor, I'm trained to understand and use the conventional system. So just like your primary care physician, I should know how to make a diagnosis and work out that diagnosis. That is with testing. Oh, you're quite all right. And pharmacology is a part of my training, but in addition to that, also with our nutrition, botanical medicine, adjustments like a chiropractor, homeopathy, and really a holistic perspective, right? So I want to be a little bit more comprehensive and spend more time with my patients so that I can hopefully get to the bottom of what's going on and why. And ultimately, when I do treatments, my goal is to reverse whatever is happening, right? Support their bodies so that their body can do something better on their own. So I went to the National College of Natural Medicine. It's there's only a handful of accredited schools in the country, and that's where I got mine degree from. And so these are my objectives for today. Provide an overview of detoxification, right? What is that? What does that mean, right? It's kind of a fancy word, but really, what does that mean? And really, within that room, we're going to talk a lot about the liver. So what are the functions of the liver? Where is your liver? What does it do? Feels like good information to know, so we're going to talk about that. And then how does that relate to my overall health? Specifically, what are just how does that relate to my overall health? And then talk about some things to do for improving detoxification. Not because it's this fancy term, but because it serves an actual function in our body. And we care about how our body functions, right? And this to me is the ultimate thing in our body that we're trying to protect, right? Every cell in your body, right? This is what's going to do everything that happens in your body. This is what we want to protect. When some damage happens to a cell, a single cell in your body, that's when disease can start to happen. Right? It just takes one crazy renegade cell for cancer to form, and the environment that cell is in is going to determine the health of that cell. But ultimately, that's part of my perspective. I want to protect the integrity of the cells in the human body, right? So let's talk a little bit big picture. Yeah,
sorry.
Did you bring a doggy treat?
No.
Did you bring some for everyone? So let's talk a little bit about kind of big picture philosophy, right? It's very important to me. So this is what I would call kind of the conventional model, right? Conventional medicine, or what I might also call the drug paradigm, or organized medicine, right? I'm not saying it's bad, right? It's there, and it can serve a good thing, but it has its limitations, and we are all familiar with those limitations. Otherwise, we probably wouldn't be here, wasting 90 minutes of your time listening to me talk, right? So, and to me, this is how I simplify it, right? You go in to see the doctor. They want to make you have very limited time, 15 minutes, which sometimes less, and they want to nail down a condition very quickly, prescribe one single treatment, and then that's it. We're done, right? That to me is the conventional model. Well, that definitely didn't work for me. It doesn't work for me as a patient, and that's why I went into naturopathic medicine. I wanted to see what else is out there as far as, and still uses the biomedical model, still professional, still licensed in that. So what's a different model that we can use? And ultimately, it just comes down to that health or disease is more complex than that, right? There are more things going on. There are multiple things that are happening, and I think it's good medicine to take the time to understand all of those things and take them into consideration when you're creating a treatment. And to me, that is how you do preventative medicine. That's how you create long-term health, is by taking that into consideration. So another way to think about that is that disease, more or less, right? It's kind of a negative term. Disease involves a lot of different factors, right? It involves your genetics, what you came into the world with. It also involves the environment that those genes interact with, right? The foods that you eat or the nutritional status of your body is impacted by the stress in your life. That's very well researched and clear. It's impacted by your lifestyle factors, right? Certain lifestyle factors are risk factors for certain diseases. It's impacted by your environment, which is very small, but that word says environment, right? So your environment impacts a disease, right? So if you're exposed to toxins, if you're exposed to heavy metals, it's going to make an impact on disease. And conventional medicine still does this, right? They take a history and they try to get a wide array of information. I just think that I want a little bit more. I want a little bit more than 15 minutes can allow me, right? And then on the flip side, another way to think about it is that how your body functions, right? If you want to optimize how your body is functioning, which is health, right? If you want to create health, the function of your body, your health is dependent on all of these things, all of these systems in your body. It's dependent on your digestion. It's dependent on your immune system, on your nutrition, on your hormones, on your nervous system. That is going to determine how well your body is functioning, right? So I want to know, if I see a patient for the first time, I want to know, okay, they have something going on. What is this? What is going on, right? What disease can we call this? But I also want to know, how is their body functioning so that I can understand why this is happening, right? So if they have Crohn's disease, which is a digestive condition, right? It's an autoimmune condition, I want to know more details than just that they have Crohn's disease. How is their digestion? Do they have some type of chronic infection that's contributing to it? Why is their immune system dysfunctional that has caused this in the first place, right? And there are multiple things that are related to that. Right, so I mentioned disease can be influenced by all of these things. Well, similarly, your health is influenced by all of these things, right? Your health is influenced by your genetics, it's influenced by your nutrition, by your stress, or how you manage stress, influenced by your lifestyle and your environment, right? Similarly, your health is made up of all these systems, your digestion, your immune system, your nutrition, hormones, your nervous system, right? So to me, they're two sides of the same exact coin. Think of them similarly. Think of them how I diagnose disease. So not only do I want to know what condition is this, but why is this happening and how is the body functioning in terms of all of that information. And I want to use that to understand someone's health. Does that make sense? So I mentioned, kind of this model, which in chronic disease, and this is really an acute care model, right? You have an acute infection, you have strep throat, you go in to see the doctor, okay, let's do some physical exams, let's look at your throat, let's take your temperature, let's do all these things. You have strep throat, here's an antibiotic, and then we're done, right? Great, that's great if the strep clears up and we don't have to deal with this anymore, but what do we do when it's a chronic condition and there are multiple things happening that create that, right? And so that's the thing that is frustrating, is that the conventional system or organized medicine is really set up still in this acute care model, but not in a multifactorial, right? And so for me, this is another way to think about it in terms of what I do, what I think is how we should be thinking about it for a chronic care model. So how does disease happen, right? So you have your level of health, right? At this point right now, all of us have a certain level of health. It's not good or bad, but let's just say that's what it is, right? It's made up of all of these different factors: your genetics, your environment, your lifestyle, your past medical history, things that have happened in your life. We could also call that terrain, right? Just to use kind of a word, terrain. And then something happens, right? Some type of interfering factor, right? You get exposed to something, you have some type of traumatic experience, you get an infection, or it could be a good thing, right? You take some type of medicine, it could be a drug, a homeopathic remedy, a herb, whatever it is, something engages with your system, and then you have a reaction, right? And that creates a new set point. To me, that's the model of thinking about what is going on, both in how disease happens, but also in what we do about it, how we reverse that process. And so this is happening all the time, right? This is written as kind of a linear process, but it's happening all the time in multiple different ways. So I think about it in terms of a cycle, right? We have this terrain, something happens, some type of intervention, could be good or bad. You have a response, then you have this new set point, right? And that cycle is constantly churning, whether we want it to or not, you know, for better or worse. And it doesn't mean it's good or bad, but that's just constantly happening. Yeah. I'm just being kind of philosophical. Please, that's
No, that's okay. I understand.
yeah.
The downward or terrain, sorry.
Nope. You're fine. You're fine.
The terrain is what?
Terrain is everything that makes up your health today, right now. Made up of your genetics, made up of your past experiences, made up of your what life, made up of the food you're eating right now, made up of
Anyway.
made up of everything, right?
Mhm.
That's your terrain. That's
Okay.
your body. Just
Okay.
think of your physical body.
Right.
Yep.
Okay.
Your physical body. But there are lots of different factors that impact your physical body, right?
Mhm.
Past exposures you've had, past experiences you've had, past meals that you eat, and so on.
So new set point is what?
A new set point is a new set point is so let's say this. You understand your terrain, right? Your physical body right here, right now. Let's say after you leave here tonight, you something.
If you're positive, just say
I'm trying to think of
she
something.
took some sort of health remedy that helped her sore throat.
Yeah, or let's say, okay, let's say at this point right now that you have this strange pain in your leg, right?
Right.
And you've gone to see orthopedics and you've had x-rays, no one can really figure out what's going on. So you, as a result, you try something else. You take, let's say, just a single homeopathic remedy. And then after you take that remedy, all of a sudden the pain goes away. So that's your new set point, right? You had your particular terrain, you had something going on, you had some sort of intervention, you took a medicine, right? I'm not saying homeopathy is good or bad, but it's medicine as far as I'm concerned. It's what a drug is.
Yeah.
And you took that medicine, you had a response, and all of a sudden you had a new set point. And that new set point is better than previous.
Okay.
Similarly, we could come up with a negative example. Let's say you had some type of exposure at work, and all of a sudden you have chronic lung disease because you got exposed to silk dust or whatever. And then you had a new set point. That new set point is this lung disease. And this is constantly happening all the time.
And are you just intervention injury?
Yes.
Is
Anything that you interact with.
that hurts my eye.
Or helps your body. Just like that homeopathic remedy that you took that took away that leg pain. Remember how that happened?
Yeah.
Right? Does that make sense?
That was your intervention, when you took something to help yourself out.
Yeah.
That was intervention, or the opposite
I
would
got
have been if you got hurt.
Or let's say you go into the doctor because you have depression.
Right.
And you have difficulty working, and difficulty getting out of bed, you go in to see the doctor and they say, you know what, I think I've seen patients with this before and they've taken this drug and I've seen them be helped. I'd like you to take this drug. So you start taking this drug and all of a sudden you feel better and you can function better, you can function more. And that to me is a new set point, right? Then you're right back into the same place, which is your terrain. You're just in a slightly better place because you can function.
Or a worse place too.
Yeah, or a worse place.
Yeah, it's different than it was before your intervention or your injury.
And so that cycle can either push you up kind of the ladder of health, so to speak, or push you in one direction or another. So that cycle is happening all the time. It's either a downward spiral or an upward spiral, right? And to me, when I think about health or I think about creating a treatment plan, I want to do the right combination of things and pay attention to the right combination of things so that we create an upward spiral in terms of how you feel. Right? So for me, these are all the areas that are important to me. Right? I want to know what some of the disease is, but I also want to check in on all these areas. How's your sleep? How's your digestion? How's your mood? How's your energy? How's your performance?
That was nice of you.
So that's my perspective as an integrative doctor.
Can I ask you something about
Yeah.
sleep, just in general, because a lot of these
Yeah.
Fitbits,
Yeah.
all these things. And I don't have anything to test on. Is there anything anybody knows?
How to test how well you're sleeping?
Yeah, if you're going
Yeah.
deep REM sleep or,
Yeah. So you can do sleep study. Is one way to do that.
okay, so you have to physically.
You can. There are also other pieces of equipment that you can use that are less invasive and easier to do that you can do. And I am familiar with some of them, but I haven't used them in my practice. I know of one in particular that I've thought about using, but I haven't jumped into yet. But there are devices that you can do that track how still your body is when you're sleeping, how you're breathing, various things. And I'm not an expert. But there are ways to do it, and they cost anywhere from $100 to $300. I thought about buying one for my practice and then just lending it out to assess it. I haven't done that yet. So let's get to the topic at hand. Enough philosophical. What's it, waxing? Is that what you said? Okay. Let's talk about detoxifying. So when we talk about detoxifying, what are we talking about? Right? What are we detoxifying?
So throw the bad stuff.
Throw out the bad stuff, right? Our bodies, so stuff in our bodies that's bad that we don't want. So they could be things from the environment, right? It could be from our air, it could be from our water, it could be from hair products or cleaning products, right? It could be from upholstery, right? Their furniture is filled with gas fumes, not kerosene gas. Gas off gas. Yes, it really is. This also means microorganisms, so bacteria, viruses, fungi, also antibodies. So these are chemicals that our immune system makes to attack certain things. Our body will detoxify or get rid of those things. There are also things that our body actually makes. So a lot of what we detoxify are things that our body is actually making. So it's not just simply things that we're exposed to, but it's also things that our body just makes and naturally how our bodies function. Our bodies make toxic materials that our body has a way
You
to.
mean like when our oxygen comes in, we let out?
Carbon dioxide. Yeah, so carbon dioxide would be an example of that, but there's lots of other, just more very nuanced and specific examples. But the point being that our body actually makes toxic materials that our body then has to figure out what to do with. It's just a part of the normal functioning of our body. And primarily what we're talking about are things that are fat soluble, right? So hormones, drugs, and toxins that dissolve in fat. Right? So if it's water soluble, then what should happen? Our body should be able to urinate it. We urinate every day. Our body should be able to urinate that out. And part of the major process of detoxification is your body goes through a process to make things that are fat soluble that otherwise can't necessarily pee out. Make those things water soluble so that your kidneys can get rid of it, right?
Wow, that's
So-
interesting. And so if you have like they say you have.
Whenever you get this.
No, I'm sorry.
No, you're good.
Go
You're
ahead.
great. No,
You know, they
it's my
show-
fault because I'm.
They show pictures on TV about, how you have this big fat cell,
Yeah,
and then you can shrink it down by whatever.
yeah.
Okay, so does that mean that all those toxins are being more concentrated, or are they actually going out with the thing? Does that
It could mean that they're going out. It could mean that they're leaving your body. So yeah, so your body stores toxins in fat. So where is fat in your body? So it is everywhere, but where specifically in your body? So in your bones, right? In the very middle of your bones, the bone marrow. What's that?
It's everywhere. I wasn't even counting that.
Yeah, your bones, your nervous system, so your brain, and then also fat cells, right? So fat cells here, right? Even I have some, I know it's like here, but then also there's a lot of fat around the internal organs, right? That's where your body naturally stores toxins.
It seems hopeless.
We're just getting.
No, sorry, don't go there.
And that is actually the point of my talk, is that it is hopeless. That's all we're gonna do.
You like your humor.
So what is detoxification? Oh man. Detoxification is the process of neutralizing or removing harmful substances from your body, getting rid of the bad stuff, right? Or changing it so the bad stuff doesn't do harm to your body, right? Because it can be. So toxins the body is not able to eliminate will ultimately build up in tissues and potentially disrupt the main thing that I want to protect. What is that main thing?
I don't know.
The cell.
No, what is that?
But you're happy, yeah. Good. Small picture, big picture. Perfect.
That cell looked like Peter Pan's island.
You need to tell me that toxins go into the bones?
Correct. So lead, mercury, yep.
Yeast.
Sometimes people have really bad. Sometimes if people have bad toxic exposures from a work environment, for instance,
Right.
it can disrupt how their bones make the cells of your blood. So the white cells of your immune system and the red cells of your carry oxygen. It will disrupt that process and create disease or some type of cell blood cancer or bone cancer. Okay. So what is doing this? What are the players in this process? Right? We're talking mainly about the liver. We're going to talk a lot about the liver. And then also the kidney, right? So I mentioned that the liver is helping to make things that are fat soluble into water soluble so that your kidney can get rid of them, right? So your kidney plays a strong role as well. Also your intestines play a strong role in detoxifying and have a strong connection with your liver. And then of course, your blood is necessary to move things around, to transport things from your liver to your kidney. So these are your kidneys, right? They're right here, kind of in the back, and on the other side in the front, you have your liver and your intestines that make up this entire your abdomen, right here. And then this is a picture of your kind of a drawing of your circulatory system, your bloodstream, right? So the red is blood that has been oxygenated, that has picked up oxygen from your lungs, and the blue is coming, and so then it carries it to tissues, right? Your muscles, and it delivers that oxygen, so your muscles can go to the gym and pump iron, right? Like you did this morning. And then after that oxygen gets used, that blood goes back to the heart and back to the lungs, right?
What are the clumps in the middle?
Those are capillaries. It's just how they just branch off so that they can deliver stuff to tissue, basically. But the reason I wanted to put up this picture is to show that this right here is a representation of the liver, right? So you have, just like any other organ, so this is your upper body, this is your stomach and intestines, this is your lower body, you have fresh blood that's going to your liver. But you also have blood that's going from your intestines straight to your liver, so that your liver is there to monitor and pick up what is coming in through your digestive system, right? And why is that? Because you're exposed to the outside world in your digestive system, right? To see, are there any microbes in there, are there any viruses in there, are there any things that are toxic that we don't want, right? So your body has the system made up to filter what's coming in through your digestion. So those things are strongly linked together, liver and your intestine, which is why when we think about digestion, when we think about detoxifying, we also want to think about what we're putting into our mouths when we're eating something, right? It's why we want to choose organic over fruits and vegetables that have pesticides in them, because they don't limit the load on our liver. Does that make sense?
Totally. Yeah,
Totally.
what tests can you?
Oh, Sydney, what's that?
What tests do you get people to tell how actively their livers are working?
I don't usually do that. I usually just kind of go off of,
Tests like that?
you know, there are, and I'm not honestly not that familiar with them because I don't use them that much, and I'm not sure how much stock to put into them. You can look at, there's some genetic things that you can test to look at how well, so I actually will do that sometimes. There are some other very complex tests that you can do to look at liver function, but it's not something I regularly do with a lot of people. I more go off of what's the presentation and what are other things happening. So this is a graph that I made that kind of shows or displays the path that a toxin will take to get out of your body, right? So it's a fat soluble, right? So let's say it's in your cell, and let's say it goes through your intestines, your blood. Ultimately, we want to get it to our liver. We want to allow the liver to do its job and hit the exit sign.
So fat?
Yes. And every cell is surrounded by fat, right? So that picture that I showed you, it's made up in a very specific organized way. It's surrounded by fat. So it's going to be, so things that are fat soluble are going to move more easily inside and outside of the cells.
So,
Yes.
so what are we talking about here? So
We're just talking about the path that a toxin will
takes.
travel in your body. Something that we don't want. What does it have to do? It has to get into your bloodstream, get to the liver. The liver has to do its job, and then send it through the exit routes, which are either your kidney or your gallbladder. This is how your body detoxifies naturally. What your body's doing all the time. It's doing it right now.
So how hard is it on your body if you've had your gallbladder appendix removed? Then you don't have another site to another.
Yeah, I think that people do pretty well. It really depends on the person and what's going on and other factors. People do pretty well regardless. It would be my preference for someone to have gallbladder, but if they don't, that doesn't mean that, they're going to die in 2 years or something really bad. People can function well. So let's talk a little bit about the liver, right? So that's what we see right here in the center, right? It's the liver. The liver is the main station where this is happening. Right? So let's talk about the liver. So the liver, I like to think of as the laundry room of your body, right? So what happens when your laundry room gets backed up, and right, it starts to affect other things, right? And the liver is ultimately cleaning and organizing things that need to be put away, right? There's this constant cycle of clothes that we're wearing every day, and that's what the liver is doing. It's processing the things that we're using and utilizing on a daily basis, getting rid of byproducts that we don't want, helping to put things away into the nice place, right? And the point that I want to make is that, so again, when that laundry room gets backed up, it starts to affect other things, right? Clothes maybe pile up in your bedroom. Maybe there's dirty towels in the bathroom that hang around for a longer period of time. It starts to affect the environment that is outside of that, just that specific room, right? Similarly with your liver, if the liver gets overwhelmed or backed up, it starts to affect other systems, right? It starts to affect other areas of your body. It starts to affect hormones and how you regulate blood sugar, mucous membranes of your intestines, and other areas of your body, right? That's the point of that analogy. So if we looked at these two pictures, and if we were just to kind of imagine in our mind what the rest of these homes look like, which do you think is going to be more clean? And healthier, right? That's the point, right? The one on the left, right? No, the one on the right, right? So the laundry room of your body, this is your liver. Does anyone know where your liver is? Where is your liver in your body? On the right side, right under your rib cage, right here. On the right side. Okay, so what does your liver do? These are the three main functions of your liver. So you can live without a gallbladder, but you could not live without a liver. That's why it's called the liver.
You can live with part of the liver, right? I think I've heard people have.
Probably. I don't know details on that. That's probably the case. I'm actually not sure. I actually don't know. I mean, it depends. It depends on how much, I mean, certainly you can take some out, but let's not experiment. So, what does it do? It filters the blood, right? Which is removing large toxins, right? It creates bile, it synthesizes and secretes bile. And what is bile? Bile is just a concentrated form of toxins and things your body is trying to get rid of. It also breaks down chemicals in your body that your body does not want anymore. Right? So it filters the blood, it concentrates fat-soluble toxins in the bile, which your gallbladder is going to help get rid of, right? Because your gallbladder is going to spit it out into your intestines. Then your intestines to help get rid of it when you have a bowel movement. That's why we want to have daily bowel movements. So we're helping our body get rid of toxins.
Doesn't it also distribute, like if you take a drug, will it distribute it, or your alcohol, will it distribute
Well, your
it?
bloodstream is going to distribute it everywhere, but yes, it'll start to process. That and other parts of your body will start to break down that drug.
Where are the macrophages and red blood cells and things like that fall into this?
Your spleen does a lot to clean that up, but your liver can do some as well. But your spleen that's the main job of your spleen is to clean up cell debris. That's what they call it. Red blood cells that are dead.
Before you go on, so phase 1 and phase 2 enzymes.
Yes, we're going to talk about that.
Okay.
It's just a process of breaking down chemicals in your body that your body does not want. Right?
So how does it know what you don't want?
It's just really smart.
Okay.
Yeah, and the enzymes.
You don't need to worry about it. It knows. It
Right.
knows.
Well, you said that the blood distributes everything, so how's the bad stuff not getting out all over the place?
Because your liver
You said it was smart.
because your liver is doing its job.
Okay.
Enzymes, where do enzymes come in there? We've got part 2 enzymes.
What's that?
Okay. Phase
Here?
1 and phase 2 enzymes.
Yes.
Okay. Enzymes,
What are they?
yeah, you know,
They're just they're just little chemicals. They're just little molecules. They're chemicals that your body naturally makes to do a certain process or something specific. Okay, so continuing on the functions of the liver. Remember the 3 main functions were to filter blood, get rid of toxins through the bile, and then also break down and get rid of unwanted things your body doesn't want. Right? What are other things that it does? It helps regulate hormones, helps break down hormones that your body doesn't want anymore. But it also helps balance hormones. It supports your immune system. It also helps your body balance blood sugar. And any type of biochemistry that's going on in your body, making or breaking down neurotransmitters, making or breaking down hormones. It's the central station for that to happen, right? It's like Grand Central Station. So it's important. That's the main piece. It's important. So it serves a lot of functions as far as a variety of areas, right? So that's immune system, hormones, neurotransmitters, etc. So we're still talking about the liver, right? So one of the main things that your liver does is it gets rid of large toxins, right? And it does that with the type of cell of your immune system that's kind of like a Pac-Man, right? So you have all these Pac-Men that are in your liver that are hanging out where the fresh blood is coming in from your intestines. Remember I showed that picture where you have all this blood coming in from your intestines? So it's going into your liver, and you have these Pac-Man cells that are hanging out and they're gobbling up large molecules, toxins, or even organisms like bacteria, and helping your body process them, right? And so these pictures are real pictures of these Pac-Man cells that are hanging out and waiting, ready to gobble things up.
and what are those things? What's the purple thing?
Right here,
Yeah.
it's called a Kupffer cell, and it's a Pac-Man. It's Pac-Man.
Oh, okay.
It's Pac-Man. And it's a cell of your immune system, right? So your immune system is constantly hanging out in different parts of your body, right? It's in your lungs, it's in your intestines, and it's monitoring what's coming in from the outside, right? And if something comes in from the outside that your body doesn't want, what happens? It gets activated, it starts to send out signals, it sends an alarm, recruits other, fire trucks to come by, or
Right.
ambulance to do something about it, right? We could also call that inflammation, right? The same thing is happening in your liver. That's one of the main roles that your liver serves, is it's filtering blood that's coming in from the outside. And it has these alarm systems set up that are ready to activate that alarm signal if something happens, right? The main point being that it has a connection to inflammation in your body. So that inflammation can be triggered if something is entering your body that your body doesn't want, or if your liver gets overwhelmed and these Pac-Man cells are not able to keep up, right? There's too many of these, I don't know, what are these ghosts? Are they called ghosts? What are those guys called? Come on.
I'm not that sure.
There's too many of those guys, running around. What's going to happen is that Pac-Man is not going to be able to gobble them up, and then they're going to be able to do damage. Right?
So you can help that.
Yeah. Well, you're doing. Yes, so you can help. Yeah, there are things that you can do. And the point being that I'm trying to show how these things are related, right? So what you're exposed to has a connection to your immune system. And so that if you start developing a chronic illness in which your immune system is involved, let's look to that piece of how your body naturally functions in order to understand potentially how to best treat it. Or let's support that, just over time, let's support it. Let's support our liver. Let's do castor oil packs. Let's do dry skin brushing. Let's pay attention to the foods that we're eating in order to optimize that function so your liver doesn't get overwhelmed and then inflammation gets out of control. Because we all know that inflammation, what's wrong with inflammation? Is it, what's that?
It's the demon.
It's linked to lots of different conditions, right? It's linked to everything. It's certainly, more nuanced than that, but that's the overall. Does that make sense? We haven't fun yet? You're ready to take the quiz at the end?
I
You
know.
prepared? Okay, so we talked about what does your body do? Filters blood, it synthesizes and secretes bile, and it also breaks down unwanted chemicals, right? So we talked about filtering blood. Let's talk about breaking down unwanted chemicals, right? So your body has this natural process that happens called phase 1 and phase 2. Has anyone ever heard of this before?
Never know.
Yeah, Mary, right? That was your name?
Yes.
Mary, and what have you heard? What do you know? Have you just kind of heard it in the atmosphere?
I understood it a little bit back.
Oh, yeah.
I'm trying to be quiet back here.
No, I exposed you. No, it's fine.
Yeah.
So phase 1 and phase 2 is a natural process that your body is doing in order to break down unwanted chemicals, right? It's what so we talked about, I said, what is detoxification? You said getting rid of things that are bad, right? So one of the ways to do that is to break down chemicals that your body doesn't want. And phase 1 and phase 2, detoxification, is one way that it does that. And this is happening all the time. It's happening constantly in your body, right? It's happening right now. It's happening a million times over every millisecond, right? So your body's constantly doing it. Does that make sense? And the other thing is that it's actually happening in other parts of your body as well, not just your liver. So every cell in your body is helping to contribute to this process in one way or another, more or less. But your liver is the main station in which this happens, and the main way in which your body gets rid of things that you don't want, right? So you have fat-soluble toxins that come into your liver. It goes through this process. It goes through phase 1, then it goes through phase 2, and then it makes those fat-soluble toxins. What does it do with them? It makes them water-soluble, right? And then it sends them to your kidneys so that you can pee them out. Does that make sense? Phase 3 is the exit. Is the exit path. Is the exit strategy, right? It's getting out the doors. Because if we're not having daily bowel movements, if we have constipation, or if our digestion is not optimal, or if we're not, urinating every day, then those areas will be blocked, and what's going to happen? Things are going to get backed up, right? And what happens when things get backed up? It starts just like that laundry room. When that laundry room gets backed up, it starts to affect other areas of the body. Right? It starts to kind of spiral out from that center. So this is just kind of a picture, to represent that process. This is another picture to represent that process, which is much more busy, and it shows the toxins, it shows the nutrients that are involved in this process. But don't worry about that too much. What I wanted to point out is that, so you have these fat-soluble toxins, right, that come in through phase 1. Your body goes through this process, it does these different things, it creates this other product, and then it goes through phase 2, and then it sends that into where your body can excrete those products, which is phase 3, right? And the process of phase 1 creates chemicals or parts of our body that can actually do damage to our body, right? So has anyone ever heard of free radicals or oxidative stress, right? Just like inflammation, it's kind of this nebulous bad guy, right? So in the process of detoxifying, your body creates free radicals. That phase 1 creates a lot of free radicals. And the reason why that's important is because if your phase 2 is not adequate, phase 2 is not functioning optimally, then you're going to end up creating more free radicals that are going to do damage to your body than you want to, right? And what are the things that, so free radicals, right? It's kind of a specific word, but they're really, just think of them as, let's see, what's an analogy? Rust. What's that? Yeah, like rust on your car, or just, or even something that's going to do damage to the inside of your car if it's kind of bouncing around. What's that?
Sunburn? It's bad?
Yeah, sunburn actually is not a bad example, because that's kind of an example of oxidative stress. But what are the things in our environment, things that we can eat, or take, or whatever, that help deal with that oxidative stress? Right? There's sponges that we can use that will suck in and kind of take care of that oxidative stress. We don't know what those things are. What's that?
Berries.
Berries, yeah, totally. What are in the berries? Antioxidants, right? So, antioxidants, this is a buzzword, it's popular, but that's what they're doing, is they're acting as sponges to those free radicals that otherwise could do damage. Could activate our immune system, could contribute to inflammation, could disrupt neurotransmitter balance, disrupt hormones. Basically, oxidative stress or free radicals can disrupt different systems in your body that then can present as disease, right? So if we're preventing that from happening, then we're doing preventative medicine, being proactive. So phase 1 creates free radicals, and then our body uses antioxidants to squelch those free radicals and ultimately detoxify. And really, technically, when we say the word detoxification, this is what we mean. Phase 1 and phase 2. So filtering the blood, that's just a function of the liver does. Detoxification, technically, means this process of breaking down chemicals in your body. And sometimes, you hear about it in the news, or people talk about different products that do this or that or whatever. That's what we're talking about. So going back to phase 1, the purpose of phase 1 is to directly neutralize some of those chemicals or convert them to another form that are, as I just mentioned, can sometimes be even more toxic, right? So it can create something more toxic that your body knows what to do with. And the specific set of enzymes that your body uses is the cytochrome P450. Has anyone ever heard of this other than Mary? Anyone else ever heard of this? Sometimes it's kind of in the news or it's popular. It's just a set of enzymes your body uses to break things down. How about grapefruit? So we all know that there's something about grapefruits and drugs, right? There's some connection there.
Right. Can't
Supposed to eat grapefruit or not supposed to eat grapefruit? A certain amount of grapefruit, what's the
You're
deal?
not supposed to eat it.
You're not supposed to eat it. And why are you not supposed to eat it?
It won't let that drug do its job.
So it slows down cytochrome P450. It slows down the phase 1 enzymes. Or does it speed it up?
No,
I just got
think it
confused.
blocks
Mary,
it.
what do you know?
Slows it down.
It does slow down. I did get that right. Okay. Just second guessing myself. Oh, the other thing I wanted to say is that this phase 1, there are other cells in which this is happening. It's also happening in the brain. It's happening in all cells of the body, mainly in the liver cells. So phase 1 is going to break down drugs. It's going to break down pesticides. It's going to break down caffeine, right? So those people that can drink coffee maybe late at night, it doesn't keep them up. That means they have good phase 1, strong phase 1 going. That is not the case. Like myself, I cannot drink coffee and be able to go to sleep in the next 4 days. It's that phase 1 is just, could be a little bit better. And also some hormones and histamine in particular. And what are the nutrients that are used in phase 1, right? So I showed you this dramatic picture that showed all the different types of nutrients that your body uses in order to do phase 1. What are some of those nutrients? So copper, magnesium, molybdenum, manganese, iron, zinc, also known as trace minerals, right? Does anyone know where to find those trace minerals in food? We were going to maybe eat food focused on trace minerals. What type of food would we find? Green. Totally, yeah, so vegetables, right? So vegetables are concentrated minerals. Green leafy vegetables.
I don't know what that molly,
What?
that third one down, I don't even know what that is.
Oh, molybdenum.
Never heard of it.
That's all right. Just forget
Don't bother me with
about it.
So leafy green vegetables are concentrated minerals.
Yes, trace minerals. Yes.
I have a friend who's on a ketonic diet, and I had a real hard time explaining to him that he should be eating something besides just fat and cheese steak and some kale.
Yeah, I don't like the ketogenic diet, is it, or like for doing ketones, is that what you said?
It's just kind
Yeah.
of burn on.
Yeah, I really don't like that, personally. So, other nutrients that we use, vitamin C, right? Where do we get vitamin C? Where's that in our food?
Grapefruit
Grapefruits?
or orange juice.
I actually am not familiar with that. Orange juice,
Kiwi.
kiwi, broccoli, again, green food. Yep. And thiamine, riboflavin, pyridoxine, niacin, folate. You could also call those B vitamins, right, which are found in egg yolks. But it's one good egg yolk with a nice orange color. Also in whole grains. And flavonoids. So phase 1, we use flavonoids. And what are flavonoids? Flavonoids are all those bright colors we see in fruits and vegetables, which is why we want to eat all of the colors of the rainbow. So we get all those good antioxidants, all those good flavonoids. The bright purples and blues and reds and oranges.
So when they say some people don't keep vitamin B in their body, so they have to take a supplement, what's their liver not doing? Or what's it doing?
Well, I think it potentially is more complex than that. I don't know. First of all, a lot of the bees are not stored very well in the body because they're water soluble. But it may not be that they're not stored in the body really well. It may be that they're usually when I think about B vitamins being depleted, I think about stress because they play a strong role in stress. P5, P6, especially B12. So that's what I think about. Their body's just better. But it's so complex. Every single individual person has different nutrient needs. And, you know, there's some foundation, but everyone's similar. So how can we optimize, going back to, remember we're talking about detoxification, getting rid of unwanted chemicals, phase 1, phase 2. How can we optimize phase 1? Eat plenty of brassica family vegetables, right? So what are some brassica vegetables? Does anyone know? What's that?
All the kale.
All the kales. So cabbage, Brussels sprouts, cabbage, collard greens, which are kind of spicy a little bit, right? Salt-free. We eat brassica family vegetables. We eat foods rich in B vitamins, so whole grains, egg yolks. We can eat foods rich in vitamin C, broccoli, cabbage, peppers, tomatoes. Citrus foods as well, which have this chemical called limonene, which is really helpful for detoxification. It's found in orange and lemon peel, actually. And also essential fatty acids. So in fish oil, the EPA and DHA that's in fish oil is helpful for phase 1. What's that?
I'm behind you, yeah.
Noah told me to tone it down a little bit, but I don't think I did that. I think we did a lot. Next time.
Well, this is delicious. Great.
So, I know that the main popular pain relievers, some are processed through the liver, some are processed through the kidney.
Mm.
So how do you get it
Like
processed?
NSAIDs, like drugs.
Yeah, that kind of stuff. So how do you get it processed through the kidneys if it all goes through the liver anyway?
I'm not clear on that. I'm not really sure. It doesn't make sense to me. I don't know. My understanding is that the liver is processing all drugs. So that doesn't make sense. Okay, so we've done phase 1, right? We've gone through this process. We're trying to break down unwanted chemicals. We're trying to make fat soluble toxins, which our body could store in fat areas of our body, or get into cells, or get into our bone, or disrupt the way it functions, of cell functions. So we're going through this phase 1, but we're creating potentially some oxidative stress and some free radicals damage. So now what? Now we need phase 2 to do the rest of the process, right? So phase 2 is going to neutralize the toxin or make it water soluble. It's going to act on what phase 1 creates, right? It's kind of like an assembly line. So then our body can get rid of them. And this is a list of some, and it's going to be a very complex process, and I'm trying to kind of boil it down. These are some of the nutrients that are utilized in phase 2. So glutathione, we're going to talk about glutathione a little bit. It's kind of this popular, well-known, sexy antioxidant. B vitamins. Glucuronic acid is actually in kombucha. It's helpful for glucuronidation, which is one of the phase 2 processes. That's all right. Don't worry about it.
I'm like,
Don't worry about it.
really?
Just big picture. Just big picture.
All right.
Don't worry about it.
Just eat well is what you, why don't you just
Yeah.
save me the trip down here and say, Kathy, eat well?
You already know that, and the reason why I do that is because we are going to say that, but this is why we think it. This is why we want to do that, right? It helps hammer it home. And we wouldn't be having as much fun if we just did that.
I know what else I do today.
Yeah. So I was going to talk about glutathione. Is that all right? You guys are going to skip over glutathione.
No, we're talking about, I never heard of it.
So glutathione, it's somewhat popular. There's, lots of people like to talk about it. What is glutathione? What does it do? What are some of the functions of glutathione? Really, glutathione serves many functions, especially in detoxification, which is why it's so popular. It can get depleted in the body, and when that gets depleted, it can contribute to other bad things happening. It's an antioxidant, right? So it's one of those sponges that's going to help suck up those free radicals that would otherwise potentially do damage to your body. It's going to neutralize those free radicals. It also is a really strong antioxidant inside your cell, right? So it has a strong activity inside the cell, which is helpful as far as preserving how that cell functions, right? Because that's our ultimate goal. That's what we want to do, is preserve that function. It also helps replenish other antioxidants. So it helps other antioxidants cycle through, right? Because ultimately what happens is an antioxidant is a sponge. It sucks up those free radicals, but then it also needs to get rid of those free radicals, right? So they constantly have to go through this recycling process. And glutathione helps all of these other antioxidants, like vitamin C, vitamin E, vitamin A, basically replenish those other antioxidants so they can continue to do their job and prevent damage from oxidative stress. It's strongly essential in this phase 2 process. It also has a really strong role in the balance of your immune system, so that if it becomes depleted, your body doesn't have enough glutathione, it can start to impact the balance of your immune system. So then other things can start happening you don't want to happen, like autoimmune disease or reacting to colds and flus in an excessive way, or not being able to get over colds and flu quickly, or allergies, or chemical sensitivities, food sensitivities, a whole variety. So it helps keep your immune system in balance. We want it nice and level. And it also has a protective role in the barriers of your body to the outside world, like in your lungs, in your intestines, and in your liver. Pretty much, how do we support glutathione? Eat plenty of glutathione-rich foods. So I just pulled out a few that are kind of high on the list of glutathione: asparagus, avocados. Meat and dairy have a lot of glutathione, actually. I'm not a big fan of dairy, but just as far as straight up information, that is the case. And the less processed it is, the more glutathione is there. So basically, what doesn't have glutathione is any processed food, right? But any whole food that's coming straight from the earth, coming straight from the source, it's going to have the most glutathione.
Yeah, so I'm not raw milk, I don't do milk, and I'm not eating raw egg. I don't do much.
I'm just a messenger. I'm just a
pork
messenger.
meat, there's no way. And so really, I'm like hardly getting anything. So then now
Asparagus, avocado, walnut salad.
I do a lot of walnuts, but other than that, what else
Avocado?
can I do? Yeah, I mean, I have guacamole, so sure. But what else can you do?
You can eat plenty of brassica family vegetables.
Okay.
If
Okay.
citrus fruits are okay with you, you can eat some citrus fruits that will have the limonene content, which is helpful for glutathione. You can also do, if you tolerate whey, bioactive whey, which is not a whole food, but it's a store shelf product. That is helpful for glutathione. You can also exercise. You can avoid processed foods. My understanding is that it helps replenish the glutathione, so that when it gets used, it helps turn it over the cycle.
I'm sorry, where?
Limonene rich foods,
Yeah.
citrus, other than grapefruit. Okay.
Why is the grapefruit bad?
Because of,
I do.
what's that?
Because of lots of people.
Yeah, because it slows down that phase 1 detoxification. It's going to back up the laundry room.
So like never, so not have nothing to do with
Wait a minute.
some medication you might be on, you just should never have it? Oh.
Well, I mean, your body knows what, just maybe
Yeah.
moderation.
Once or twice a week? Yeah, that's okay.
Moderation.
Yeah. Oh, okay.
Moderation.
Once or twice a week.
N-acetylcysteine, it's an amino acid that sometimes can be used as a supplement that helps your body make glutathione. these are kind of products that I will use, or different herbs and minerals, or things that I will use that are all helpful for helping your body. So, what are ways to support phase 2 detoxification? As far as things that we eat, again, we have foods rich in vitamin C and B vitamins, right? Our leafy greens, our egg yolks, our whole grains, our citrus fruits, our peppers, our cabbage. So,
So pretty much what you eat for phase 1 is good for phase 2.
pretty much. Pretty much. There's a stronger, a lot of the sulfur vegetables, which are the brassica vegetables, but also peppers, garlic, onions, they have a stronger relationship or activity in the second in phase 2. So we have those like sulfur foods.
Now,
But yes, that's correct.
yeah, okay, so then, just out of curiosity, because you have multiple sources of
Yes.
everything. But as far as cooking versus raw,
Yeah. I think it depends on the season. It depends on the person. You know, I don't think raw foods are a great idea in the winter time. You know, in general, the less something is processed or cooked, the more nutrients you're going to get in it. But sometimes cooking it helps your body access the nutrients. So there's kind of a balance there. I don't really think, I'm not a big fan of any type of dogma other than this right here, which is just eat food. Just eat whole food, eat all the colors, eat vegetables, eat stuff that comes out of the ground, mainly a plant-based diet. Don't be afraid of carbohydrates. I'm going to go through all that. And I think it's good to eat some, you know, eat a raw salad maybe once a day or 3, 4, 5 times a week. I think it's good to also eat warm cooked food, especially in the winter time.
so what do you think about all the smoothies that they're advocating?
I think that,
Brassica families.
I mean, I think that they're fine, you know. I think that if that's, I think that I'm a fan of eating. It takes away fiber a little bit, and I'm a fan of eating fiber. I mean, that's very clear from research. I think that we all do the best that we can. If that's the best someone can do for breakfast, then smoothie is better than nothing. But I think that eating whole foods for breakfast, you know, actual physical whole foods you can chew, that's my gold standard. That's the best. But the smoothie is the best that we can do then. I don't know, right? Okay. So remember, this is our process, right? Everything's mainly going through the liver, and our liver is going to send things to the kidneys and all that. What's going to happen if that gets backed up, right? What's going to happen if that process is going on? Things are going to get a little bit messy, right? And what does that look like? What does this look like in the body? Acne, bloating, swelling, hormonal imbalances, weight gain, immune problems like allergies or recurrent colds, any type of immune system dysfunction, constipation or poor bowel function, headaches, fatigue, itching, chronic vaginal infections sometimes can be indicative of liver kind of being backed up. So these are all examples of what happens to the rest of the house when the laundry room is backed up. Can I move on? Just take a picture. Just take a picture. Okay, so what I want to talk a little bit about how this creates. You guys are still with me? You guys still with me?
Yeah, the only thing I have a question on
Yeah.
is based on that list, are you indicating that allergies are not from your body
They can be. I mean, not universally.
Not-
You
okay,
know,
all right.
definitely not. I'm not trying to say universally.
Yeah.
It depends on the person. So what I want to do is, if someone comes in with allergies, I want to think about, why does this person have allergies,
Okay.
and I want to understand as much as I can, their health history, or what else is going on in their body that can indicate for me why their immune system is a little bit confused about what to do. And this may be one reason that's the case, right? So if there are other things going on that point me in this direction, and I'm, then maybe, but not universally. I'm not saying universally that's the case. Does that make sense? Yeah.
What's the BV part?
Bacterial vaginosis. Yeah.
Thank you.
Because sometimes, when you have chronic, these types of chronic recurrent infections, it's kind of like, what's going on here? Sometimes it happens once and your body can clear it, no problem, but potentially there could be a connection there, something else that I kind of think about.
A lot of
As far
those
as a
things
deeper cause.
are visual, but how do you know your hormones are imbalanced?
Yeah, so fatigue, mood challenges, sleep or energy issues. If you're a woman of reproductive age and you have menstrual cycles, then those menstrual cycles would not be perfect, right? And that may be bleeding excessively, maybe bleeding for a long period of time, maybe spotting in between periods, maybe even certain amounts of tenderness or pain. I know can be indicative of that. Right? So, you doing all right?
Yeah.
We need to take a break? Should we stretch a
I
little
think
bit?
we should, yeah. Next time,
Okay.
more than an hour. Brought it up.
That's true. I'm guilty. Take a minute. We'll take a minute. I'll drink some water. You can stretch. Not too long. We're not going to take too long. Through history and testing. Blood or saliva. It kind of depends on what's going on, but if it's really looking at it from a functional perspective, then I would usually do saliva collection. If someone's on hormones, then that's not accurate. Blood is true.
So when you damage your liver, is it repairable?
It depends on what that damage looks like and how much of it is damaged. The second you drink alcohol, that affects the actual structure of your liver. You start to get fat deposits in your liver whenever you drink alcohol. But your body can clean it up really well once you stop drinking. If you do that over time, then it starts to damage the actual structure. And then, in order to respond to that damage, your body puts connective tissue in there, and once your body starts doing that, that's irreversible. And that's what we call liver cirrhosis, when your body can recover from that.
My sister actually, she worked at General Hospital, young guy, like late teens, all yellow, and he was dying. And his whole
You have hepatitis? Do you have hepatitis?
No, his whole family came in and they were all yellow too. They were all severe alcoholics.
Oh, that's
And
sad.
it had to be bad to go so young and be that bad off.
Yeah.
So if you drink, I don't know, once, or let's say every weekend, how bad is
It depends on how much you drink.
I don't know. I'm just stating, for instance, is,
I'm just telling you, it
well, let's
depends
say,
on
well, I don't know if people have 2, 3 drinks, I don't know. So if they go out and they have a couple of drinks,
Yeah,
can your liver recoup all that?
usually. But it depends on the person. So, when the liver, I'm just going to kind of read some of this information. When the liver is, so what I want to do is tie in how this relates to your immune system. So when the liver is unable to eliminate antigens absorbed in the gut, in your digestive tract, this allows for re-entry into circulation, right? So those Pac-Men, remember, they're hanging out there, getting rid of things your body doesn't want, or those microbes, those bacteria or viruses that are coming in. When your liver is unable to eliminate those things, what happens? They go into your circulation, and then they start to get deeper into your body, right? And then it's less likely that your body is able to clear them.
That's your overflowing sink.
Yes.
Okay, what?
Overflowing sink.
Overflowing sink, so it goes everywhere else.
So I took this sentence from this old, it's kind of an older book, but Total Wellness, and there's a good chapter on detoxification, chapter 5. When the immune system's alarms are set off constantly, right? Those kind of ambulances and fire trucks coming from your liver, when those immune system's alarms are set off constantly, the result is excessive antibody formation and constant inflammation, which disrupts normal metabolic processes and leads to disease, right? So when that's constantly happening, you have too many fire trucks buzzing around the city, and other cars can't get around and do their job.
Could you just repeat that
I can. When the immune system's alarms, when the immune system's alarms are set off constantly, the result is excessive antibody formation and constant inflammation, which disrupts normal metabolic processes and leads to disease. And those Pac-Man cells will release inflammatory chemicals and free radicals. What are those free radicals going to do? They're going to do damage. They're going to cause rust on the car or scratches in the paint or whatever. And how does your body take care of that? By the antioxidants and by your liver processing that. So it can create kind of a downward spiral, right? It can create kind of a downward cycle as soon as those things get depleted. Because once that starts to get overwhelmed, then your body's not able to get on top of it. So back to terrain, that's why history and what we do in a cumulative way matters, because it creates an overall picture that it's going to create either an upward spiral of health or a downward spiral of disease. Does that make sense? So we have a toxin exposure, right? It could be an acute, very dramatic exposure, right? A workplace thing, these are well documented. Or it could be chronic, long-term, low-level exposure just happening over time. Ultimately, what that contributes to is the antioxidants, and specifically glutathione being depleted in your body. Right? Your body's not able to replenish that well-known antioxidant really well. And then that starts to disrupt a barrier in between you and the outside world, your digestive system and your lungs, and contribute to a certain amount of immune system dysfunction. The alarm signals going off, the inflammation. Blood-brain barrier. And then what that can lead to is losing a certain amount of tolerance to what you're exposed to, right? So being overly sensitive to chemicals, being overly sensitive to foods. It's an example of when those alarm signals are going off or have gone off so much that no longer is your body able to cope with even just minor exposures. You get a small exposure, all of a sudden you get this really dramatic response, right? So there's this thing called TILT, toxicant-induced loss of tolerance. It's in the medical literature. It's researched and known. And you have a chemical exposure. It could be an acute exposure. It could be a chronic exposure, right? And it leads to breakdown of your natural tolerance. So you have a tolerance to being exposed to different microbes, and bacteria, and viruses, or even chemicals, because your body has all these systems in place to deal with it, right? It has your immune system set up, it has your liver, it has all these things to deal with it. Well, if you have an overexposure of these things, it starts to break down the ability to tolerate that, right? So it's aggravating your immune system, and then it starts confusing your immune system and creating a broader immune dysfunction. You start developing multiple food and chemical sensitivity. So this is how the liver and the liver's functions, when overwhelmed, can contribute to or set up the stage for different types of chronic illness, especially chemical sensitivities and food sensitivities and allergies and all kind of that.
Well, like, everyone should not be exposed to mold, but some people
are more very sensitive.
right, some people, well, you can get headaches instantly, but some people actually can be brought into emergency room. So how does it get to that point? I mean,
Well,
how
because
does somebody get that bad that they have to?
it's complicated, but ultimately all of those systems get overwhelmed, and their immune system is compromised or has been compromised from exposure. Their liver is compromised or has been compromised from exposure. And all of those things are working together, right? And just the right combination for the right person based on terrain, based on your genetic makeup, based on your previous experience.
So it might be genetic makeup thing.
Yes.
So if they got themselves all back in a good spiral,
Yes.
they still could have an issue with it because they once did.
Potentially, yes.
So,
So this is kind of a linear model, but to talk about it again in a cycle, this is what we have. This is what can happen. Breakdown of a barrier, antioxidants and glutathione get depleted. The ability of your liver to do its job gets diminished, creates inflammation and oxidative stress. Your immune system gets confused and dysfunctional. Then you have this thing called tilt, toxicant-induced loss. It's just a way to demonstrate how all these things are related. And what would that look like? So an intolerance to smells, to chemicals, to jewelry, to lotions, shampoos, detergents, multiple chemical sensitivities or skin outbreaks. This is what kind of loss of immune chemical tolerance. Okay, so that was just kind of a brief, explanation of how your immune system is strongly tied to your liver because of those Pac-Man cells and antioxidants. So, kind of jumped around a little bit, but going back to, again, all the ways to support phase 1 and phase 2, what is that? It's just an anti-inflammatory diet, right? It's eating whole foods. It's staying away from processed foods. It's staying away from foods that tend to be inflammatory or cause inflammation, which are all foods that are processed or that we mess with because they're monocultures and they're not really food anymore. They don't have a lot of nutrients. And it's really just about eating an anti-inflammatory whole foods, primarily plant-based diet, free of chemicals, eating protein, eating healthy fats like avocado, fish, eating lots of antioxidants and flavonoids, eating all the colors of the rainbow. So eating whole foods, 80 to 90% plant-based, some raw food, eating all the colors of the rainbow, the yellows, the oranges, the purples, the reds, the greens, the blues, eating lots and lots of fiber, as much fiber as you can. What are some examples of fiber? Foods have fiber.
green again, and green beans.
Vegetables. Yep, green beans, vegetables, whole grains.
Regular beans.
What's that?
Regular beans.
Yeah, legumes. Eating some protein, so I'm a big advocate for eating protein in every meal to help balance blood sugar, and eating a small amount of healthy fat.
How much avocado, in its interest, how much avocado should a person eat? Is that a avocados?
Seems all right. I don't see anything wrong with it.
Because one doctor, this is just going with my dad,
Yeah.
said that it had triglycerides.
Yeah, it's mainly monounsaturated fat is what avocados are. It's healthy fat as far as I'm concerned.
Okay.
So I don't really think.
Not a problem being full avocado.
I don't think that it's a problem. I don't think that's a problem. Yeah, I don't think that's a problem. I mean, if we drew your blood and we measure your first of all, triglycerides mainly come from eating a high sugar diet. They don't really come from eating a high fat diet. That's just not how the body works as far as, so I don't see a problem.
Okay.
So again, what are ways to support your body? Reduce the load on your liver. So what are things that would create a load on your liver, right? Toxins, alcohol, drugs. So minimize the chemical exposure through your lifestyle, right? So maybe going through your cabinet, trying to choose cleaning supplies that are maybe better, or looking at products that we use, beauty products or hair products, minimizing that exposure, minimizing chemical exposure through the diet by trying to use as much organic as possible. Helping your blood circulate and your lymph circulate by doing hydrotherapy or castor oil pads. I'll talk about it in a couple minutes. Dry skin brushing to help the lymph move. And then making sure to get the necessary nutrients that your body needs by eating a whole foods diet, but if necessary, also replenishing the nutrients with maybe multivitamin or just a trace mineral complex. Those are some basics that I usually try to do. Foods that love your liver: garlic, onions, mustard greens, collard greens, those bitter greens. Those are really good foods for your liver. I also advocate not skipping meals and eating every 3 to 5 hours. Some people think they can go all day without eating, and that just puts too much of a stress on their liver or their adrenals, really. And in fact, even losing weight can be more helpful to eat more regularly. Again, minimizing exposure to chemicals, to coffee, alcohol, drugs. Okay, so castor oil packs and hydrotherapy. So what is hydrotherapy? Hydrotherapy is using temperatured water to create whatever effect you want to in your body. So if I take a hot shower, if I just expose my arm to warm water, what's going to happen? It's going to get warm. The blood vessels that go and are in my arm they're going to get wider. It's going to send a lot of fresh blood to that area, right? What else is going to happen is that it's going to increase metabolism in those cells. So nutrients are going to get in faster, waste is going to build up faster, and get out of the cell quicker, right? It's all going to happen at a higher rate. Well, over time, even a short period of time, even just a matter of minutes, that blood is then going to pool and stagnate in that part of your body. So if you then do a cold application, what's going to happen? It's going to constrict those blood vessels. It's going to send all that blood where? To your internal organs, to your liver, to your kidney, where it can do its job that we just talked about. So hydrotherapy is simply the practice of doing that to one degree or another. There are different ways to do it.
You have to follow up with a cold.
Alternating hot and cold is really kind of more or less the idea. It doesn't have to be ice cold, but there are different ways to do it. So it's not very appealing in January, but you can, after you take a warm shower, do a cool spray to your body. That's going to help send that blood to your abdomen. You can also do, there are different ways to do kind of a warming compress. So you can I will have people do a warming throat compress, for instance, which is you get yourself nice and warm. You take a towel and you run it under cold water and you wring it out so it's still cold and wet, but it's not dripping. Wrap it around your neck and then put some insulation on top of it, so a dry towel, and then cover yourself in blankets. And what's going to happen is that your body is going to heat up that towel, and then eventually it will become warm and dry over time. You can do that with your feet, so you can be warming socks. So you can get your feet nice and warm, take a thin pair of socks, get them cold and wet, bring them out, put them on your feet, and then put thicker wool socks, push them on top of that, lie down and go to bed. You can even do a warming t-shirt.
That would work. Those feet would never warm up.
You should try it tonight. Try it tonight.
No way.
Oh
No
my
way.
gosh. Oh my gosh. You're banished from the back, from the pro.
No, wait a minute.
So,
the foot thing,
yeah.
I'm interested in that.
Yeah, so take a pair of socks that are low to your ankle and not too thick, not a thin cotton
Running socks.
Yeah, something like that. Soak them in, run them under cold water so they are wet.
Right.
Bring them out so they're not dripping anymore, but they're still wet. Put them on your feet and then put a second pair of thicker socks on top of those socks. Wool is perfect. And then lie down and go to bed. So you should do it at night.
Okay, and so what's going to happen?
And then what's going to happen is that it's going to help draw fluid from up here down to your feet. So if you have upper respiratory thing going on, even if you just have some difficulty falling or getting to sleep, it can sometimes help people get to sleep. It doesn't work for everyone, but some people are really like I've done and even prescribed wearing t-shirts. So you get a t-shirt, a tight-fitting t-shirt. I've done this on my daughter actually a number of times when she was younger and she would let me do it. Line under cold water, bring it out, put it on.
When she let you.
And put on something warmer and thicker on top. And what happens is your body, it's going to activate your circulation, it's going to activate your immune system, it's going to activate your lymph system, and it's going to dry and warm up that shirt over time. You can also do just alternating warm and cold towels to the chest and abdomen. That can be great treatment for just kind of cold and flu. And castor oil packs is castor oil soaking a cloth that roughly will fit your abdomen in castor oil. A little bit goes a long way. Slapping on your belly, some gentle heat on top, and lying down your legs.
And what does that do?
It helps draw inflammation out from your internal organs and your intestines to your skin, and it helps anti-inflammatory to that part of your body. Dry skin brushing is just taking a towel. Yes, go ahead. Yes, castor oil is really good topically. Castor oil is really good to break down scar tissue.
Really?
And if you want a really fun laxative, you can try it. I'm not suggesting.
So why dry? I mean, why not in the shower? What's the difference?
Breathing.
Is that just scrubbing down?
Dry skin brushing?
Yeah.
I think it helps activate your lymph easier if it's dry, because of the friction. It needs to be somewhat light and not pressure. It needs to be really soft. It doesn't have to be really deep. And it's just short, quick strokes towards your heart, towards the center of your body. And it helps move lymph, which is connected to your circulatory system. Those are the ones you guys have. Breathing, it can be also a really great way to detoxify. So doing belly breathing or just any type of deep breathing, even using your chest, right? So I like to prescribe belly breathing for relaxation, stress management. Which is, yep. But you can also do, chest breathing, which is going to help, lymph and circulation in your chest if you're not getting deep aerobic exercise, actually doing chest breathing. So this is helping getting rid of carbon dioxide, which is you don't want too much of it.
Wait a minute, so chest breathing, if you're not getting
Yeah.
as opposed to diaphragm.
Yep.
Okay.
Diaphragm breathing is good for relaxation, stress. It's a good daily exercise to do. It's good for anxiety. You can get used to that skill so that you can kind of bring it out whenever, you're driving or something starts to happen. You can start to do some belly breathing. It's good for relaxation. Moving your body, drinking water, and potentially doing a sauna or sweating on a daily basis helps get toxins to your liver, helps get toxins out of those cells and into your bloodstream so your body can get rid of them. And then just really quick, I had just a few ways to support the immune system, right? So we talked about liver detoxification. We talked about how it's related to your immune system. Those two things are working hand in hand. And if your immune system is overwhelmed for other reasons, then it's going to make it susceptible to also be overwhelmed if your liver starts to be overwhelmed. So what are ways to support your immune system? Probiotics. It's helpful to balance your immune system. Fish oil is helpful to balance your immune system. Optimizing vitamin D, so it may not be specifically taking a high or low dose. It depends on what your levels are for me, but getting that to a nice, comfortable range. Curcumin or turmeric is a good way to optimize your immune system. And exercise is a great way to balance your immune system. Cat's paw is an herb that can be used, that sometimes we use for people that have chronic immune dysfunction problems. Activate the immune system. And usually a pretty safe way. Okay, and again, this is my picture. This is my graph of how toxins get to your liver and out of your body, and different lifestyle things to do and where they support your body. This is my very last slide. But as far as supporting your intestines, this is why we want to eat lots of fiber. This is why we want to do casserole because they support your intestines. This is why we want to make sure that we drink water because we're helping our body eliminate. This is why we want to eat good nutrition or potentially use herbs that may support our liver because that helps support those things. So when we think about detoxification, we often only think about just the liver and its functions, which is extremely important. But what I also wanted to display is that there's lots of other things going on related to that. The reason why it's important is because it has a relationship to the rest of our body. If that laundry gets backed up, the better it gets backed up. That is my very last slide, and I'm done. Thank you all for coming, and it's been a pleasure. We've gone a little bit over, so I apologize. Thanks for coming.
Thank you. Yeah.
And yes, you have a question.
I do, thank you. There is a salt, little tiny white pills. Suggested I get my scales, it breaks down scar tissue. And of course I can't.
Do you take it internally?
The little tiny white.
The cell salt? Is it called the cell salt? I don't know, I'm not sure what that is. I can't comment on it. I don't know what it is, but as Mary mentioned, topical castor oil is very good for breaking down scar tissue. But constant reapplication every day. It's not just a one-time thing, but you massage it in there. How long?
Yeah, like when you do that pack, you take.
Oh, 30 to 60 minutes at a time is what I usually say.
And then you said heat, what do you use for heat?
Hot water bottle,
Oh, okay.
heating pad. I have a handout for a castor oil pad. I can grab it.
Oh.
How often do it?
Well, it's kind of up to you. What I usually say in my office, the first time I prescribe it is, you know what, give this a 2-week trial and do it 3-4 times a week. And that gives you a good trial to see how you respond to it. And pay attention to your body, pay attention to what's going on. How's your sleep that night? How do you feel the next day? And what other symptoms are going on? And then you can kind of gauge and decide for yourself if it works for you or doesn't work. So, as much as you can, if it works for you and it helps, as far as your sleep routine, then I, keep doing it. But if it doesn't work for you, then that's
So when you're talking about scar tissue, I had 3 surgeries, so you put it on the surgical site.
Yes. Yep.
And
Yep.
what's
So
gonna happen?
massage it in. So there's a scar right there, and I just put it in and just massage it in.
Okay, so if it's my lower back. That's
Yeah.
right on there.
There's no harm in any type of application.
Uh-huh.
It will stain clothes or sheets or anything, so know that. But there's really no harm.
My mom had skin cancer moved right here, and she just rubbed some on there. Would that help?
If there's a scar.
Well, it's only been 3-4 months.
Well, then I'm not so sure about that.
It's still healing.
Yeah, then no, then I wouldn't say that that's necessary. If we're looking for healing. Then
But it's like healed but still pink,
yeah, that would be something more specific that I can't say. Calendula oil would be helpful.
What?
Calendula is an herb. Calendula oil.
She's still supposed to be putting Vaseline on it. It's pink.
Yeah, that's calendula oil would be doing the same thing.
How do you spell that?
CALE.
And you,
Yep.
don't put Vaseline. It's trouble.
I know, but what are you gonna do when they tell her to do that?
Say, well,
What are you gonna do? Not
this is
listen?
not
I
putting
mean, I don't know.
gasoline in your body.
I don't know. I mean, I can't. It's hard for me to give people advice that are not in front of me. But anyway.
So the
Yes.
so castor oil
Yes.
has the capacity to break up scar tissue
Yes.
from
Yes.
us.
Yes.
And so how do I know that the scar tissue is broken up? I mean, I go get massage weekly, I don't know, if you could tell.
Yeah, well, that person would be able to tell, I imagine. I imagine that you would be able to tell. I mean, if you have scar tissue, then I would expect that you would know it.
It's hard, yeah.
Because it's hard, and
Right.
it would potentially limit some mobility, or you would feel it. So that's how you would know. So that something would change as far as how you feel it when you feel it, and also
And
the
it's
inside and
also
outside.
got a fusion under there with bone, so it's hard to distinguish scar tissue from bone.
Yeah, that's the best that I can say. We're gonna go grab a casserole. And, yeah, I'll grab all of them. And then you can stuff it out. Yes.
Take that.
Okay. This is the sound.
Out.